Hi doctor.
Hi, may I know your consent?
Doctor, I have two missing tooth on the lower back tooth region. Is it necessary to replace the missing tooth?
This is the most common question that I get asked from the patients on the daily basis. Hi, this is Dr. Naomi from Dr. Kishore's Dentistry. Did you know that even a single missing tooth causing a serious issue to your smiles, your jaws, and your general health? Let's talk about why replacing the missing tooth. Number 1. Prevent the shifting of the adjacent tooth. Removing a tooth in the middle means removing a book from the shelf. The teeth start collapsing each other. The upper teeth starts to grow downwards and the lower teeth starts to grow upwards. The adjacent teeth drift to the empty spaces. It causes malalignment, biting issue, and the difficulty in chewing. Number 2. Maintain the jawbone health. Your teeth root stimulate the growth of your jawbone. When the tooth is missing, the bones start to shrinking. This process is called bone resorption. It means your face looking shrunken and also you look older than your age. Number 3. Improve the chewing and speech. Missing tooth makes it harder to chew your favorite foods and it also affects your speech clarity. Number 4. Boost your confidence. Gaps in the smile that makes the confidence in your social and public appearance.
Okay doctor, I got your point. What all treatment options are available?
Always remember that the tooth never stops moving until there is something to stop that. Mainly, there are two options. One is removal and other is the fixed category.
Removal option, can you explain this doctor?
In removal option, the patients can remove the denture and can use it back again. We have two different options. One is removal partial and the one is complete denture.
Okay, what is partial denture and complete denture?
This is a partial denture. That means when you have some teeth or few teeth in your mouth still savable and are healthy, we can use that teeth for the replacing that adjacent tooth. Like on the that replacing the missing teeth on the acrylic or the chrome plate that forms a clip on the adjacent tooth. It forms a grip around the teeth that makes the denture stays on there. The denture won't fall out or comes out when the patient eats, laugh or smiles or eat the food. The advantage of this option is it is cheaper and it's manageable.
Fine doctor. Does it have any disadvantage for the partial denture?
Of course, there is a disadvantage. When you eat the food, it gets stuck under the denture. It causes the denture stomatitis. So it's necessary to take the denture after every meal and rinse it properly and take it back.
Then doctor, what is complete denture?
The other options in the removal category is the complete denture. When you have a missing teeth in the upper and lower jaw, that means full set of teeth is missing in the upper and lower jaw, we can replicate the full set of teeth in the denture, that is complete denture. It looks amazing and also cost is manageable. The disadvantage is the denture, it completely sits on the mouth, it relies slowly on the suction between the saliva and the denture only. It doesn't have any support from the adjacent tooth. So when the patient is in the public or the professional meetings, there is a chances to the denture to rock a bit or cause a little bit annoyance. For some patients, the complete denture adapts very well, but in some patients, that in extreme cases it is not made properly, it will cause annoyance to the patients. Removal dentures are alternative options, but it's not secure and is also cause annoyance and stressful for the patients.
Okay doctor, I understood about the removal category. Then what about fixed category?
The fifth category for replacing the missing tooth is assessed depends upon your bone and the adjacent tooth. It can categorize into fixed partial denture or bridge, and the second option is implant.
Oh, bridge. I want to know more about the bridge.
The fixed partial denture, also called as crown, you take the support of the adjacent tooth on the either side of the irregular space or the missing tooth. The fixed partial denture is a unit. It includes the crowns that cover up the adjacent tooth and also the edentulous space.
Okay, how the caps are placing on the adjacent tooth?
This is the biggest drawback of the dental fixture. We have to trim the adjacent tooth in the smaller size and we put the crowns on that and connected the crowns on the edentulous space also.
Okay, doctor. Is there any other drawback for this dental bridge?
The other drawback for the dental bridge is when you eat the food, it may stuck under the bridge. So it's necessary to cleanse the area regularly and properly, floss that area also, so that the bridge can last longer times.
Doctor, you said that there is a second option in fixed category other than bridge. What is that?
The other category in the fixed restorative treatment is implant. It is a very stable and the permanent solution. Implant is the stable option that requires surgery, but nowadays it doesn't require surgery to put the implant screw. We can use a surgical template to put the implant screw directly. The surgical template can be prepared with the use of special guide by using a 3D scan and the model of the teeth. It can guide the implant screw directly on the gums without any surgery. So we don't need to raise the flap or cut the gums. But in traditionally, we have to cut the gums and raise the flap and have the look on the bone, and then only we can put the implant screw on it. It takes more time for the healing and also a little bit painful. But nowadays, it's a keyhole and put the implant screw directly on the bone.
Fine, doctor. Does the implant is possible for all patients?
The possibility of the implant placement depends upon the several factors. The patient needs to good amount of bone and your sugar level is on normal and no other systemic complications, and you have a good oral hygiene, and you should avoid alcohol and the smoking habits and other deleterious habits also.
Doctor, what will I do if I don't have enough bone?
There is two scenarios. When your bone level is at a certain level where we can regenerate the bone, and the second scenario is the bone loss is completely happened. In first scenario, we can put the bone graft, bone blocks and other regenerative materials. But in second scenario, we can't put the implant because there is no bone to support that implant.
I have one last question. How can you decide that if I need bone graft or not?
Every dentist is assess that the patient needs a bone graft by assessing the X-ray like OPG or the CBCT. By assessing the X-ray, the dentist can get the knowledge of what kind of defect or which kind of graft is needed and the bone dimensions also. Because the patient needs a necessary bone level to support the implant. Before summarizing, I want to add the advantages of the implant also. It is prolonged lifespan, no disturbance to adjacent teeth, and also good bone adaptation.
I'm so happy. Your insights are very valuable and knowledgeable. Thank you so much, doctor.
Hope you also got an idea about this topic. If you have a missing tooth, replace it early to prevent the bigger problems down the road. Book the consultation with your dentist and smile confidently. For happier and healthier smile, visit Dr. Kishore's Dentistry. Thank you.